5 Kegel exercise mistakes you're probably making. If you ever pee a little when you sneeze, cough, or laugh, or complain about your postpartum sex life, you probably have received this advice from a well-meaning friend or even your doctor: do your Kegels. Check out these 8 solutions for a leaky bladder. Kegels, named after the MD who popularized them, are pelvic floor exercises that work and strengthen the muscles surrounding the vagina and the rectum and promise everything from better bladder control to stronger orgasms. The key to a correct Kegel is isolating the pelvic floor muscles and then squeezing and lifting. Imagine that you are sitting on a marble and want to pick up the marble with your vagina, instructs the National Institute of Diabetes and Digestive and Kidney Diseases. Imagine sucking the marble into your vagina. Simple enough, right? But it's not as easy as it sounds, and plenty of women get it wrong. Patients come in and say they've been doing their Kegels, and it turns out they're doing them backwards, or maybe they don't even need to do Kegels at all, says April Dominic, a pelvic health physical therapist affiliated with Memorial Hermann Pelvic Floor Health Center in Houston, Texas. If you don't know how to do them right, you could be making matters worse. Watch out for these 5 super common mistakes. Mistake number 1, holding your breath. You should breathe normally while doing Kegels, Dominic says. Otherwise, you may not be isolating the correct muscles. A lot of times women are not really aware of their pelvic floor muscles, so they're just trying to tighten anything they can. Holding your breath increases intra-abdominal pressure, so that can make you feel like you're doing something. Strengthening your pelvic floor can help you orgasm. Here are 6 easy exercises to get you started. Mistake number 2, forgetting the lift. Many women believe that a Kegel is just a squeeze, says Mercedes Ostergerling, a pelvic floor physiotherapist in Calgary, Canada. However, you can't forget the lift. I like to tell my patients to use visualization. Imagine picking up a blueberry or drinking a thick milkshake ... with your vagina. Mistake number 5, waiting too long to see results. If done regularly, a few times every day, you should expect to see results pretty quickly, says Weber, who treats many women after childbirth. I often have patients who notice a reduction in urinary incontinence after a week of performing the exercises. Once you are able to isolate the muscles properly and contract them, you can better facilitate your pelvic floor muscles during daily activities. If you have a leaky bladder, here's a tampon-like device that can prevent bladder leaks. If you've been doing Kegels for weeks and everything down there seems pretty much status quo, talk to your doctor. You might need some training, or maybe you don't need Kegels at all. For example, some women who experience pelvic pain and discomfort actually have tight pelvic floor muscles and need a different approach. This group should not be performing Kegels, Weber says. Instead, I have them work on downtraining these muscles with relaxation techniques and breathing exercises.